Eating slow and taking small bites and chewing them well is really one of the essentials for success following bariatric surgery. 99% of the people I see in the clinic who come back a year or two later complaining of some weight regain have developed a habit of grazing. Grazing is eating a couple of bites, waiting 10, 15, 20 minutes, and taking a couple of more bites. And this pattern continues throughout the day. And what we find is these patients are eating the same amount of food that they would normally have eaten over a day prior to surgery. So we encourage them to only eat for 30 minutes at a time, but to take small bites that don't overfill the pouch. Wait and allow that to pass out of the pouch, and then take another bite. Chew very well, because the stomach can no longer grind the food as it used to. Dr. Phoebe has a story he likes to tell our patients. He asks them, if I were to send you from California to New York and replace your 20-gallon gas tank with a 1-gallon gas tank, could you make it? Most people say, no, I couldn't make it on a 1-gallon gas tank. And he laughs and he says, oh yes, you could. If you knew where a gas station was every 20 miles, you could stop and refill. And it's the same thing with our eating. If we keep refilling our tank all day long, we can maintain our weight. It's not just limiting ourselves to small amounts, but it's limiting the whole amount to a smaller amount throughout the day. Following bariatric surgery, I think everyone experiences some nausea. As a nurse, I like to keep them from vomiting. All of those delicate sutures on the bypass patient and the lap band, I don't like the patient to vomit and risk a staple popping or slippage of the lap band. There are good medications that are available to help control nausea, but I think one of the key factors is not overfilling the pouch, and that's why I like to give patients a medicine cup and ask them to sip from a medicine cup rather than taking large gulps of water. We produce a certain amount of saliva, and it takes our brain a while to figure out that we have a smaller stomach following bariatric surgery. And so the production of this saliva continues at the rate it did prior to surgery. That can overfill the pouch and also cause nausea. So it's important for the patient to let the doctor know when something is needed to control nausea, and to let the doctor or the nurse know if there's vomiting, so we can try to control that. We give sessions on an as-needed basis to people who can't come in on a Tuesday or Thursday morning for our regularly scheduled sessions. In the session, which is conducted by a bariatric surgery patient who's had an excellent outcome, patients learn about the surgeries that are available at Tri-City, about what the surgery will mean in terms of lifestyle changes, what vitamins they will have to take, portion control, and all of the tools that they will need to make this surgery successful. Tri-City Regional Medical Center offers support groups to to our postoperative and preoperative patients. The sessions are planned out about a year in advance and cover topics such as vitamins, plastic surgery, clothing. A couple of months ago we had a clothing exchange, and we brought in an image consultant from Hollywood who talked to the patients about clothing choices and color choices. We try to make these sessions informative but fun, and the patients are able to cheer each other on and celebrate their weight loss together. We find that when our patients attend support group, both preoperatively and postoperatively, and on a regular basis, they are more committed to their weight loss and seem to have a better outcome. They learn so much from each other in terms of what to do about various foods that might taste good, preparation, that sort of thing. Often patients find after surgery that the foods that used to appeal to them, such as fried foods, no longer appeal to them. They can exchange recipes, they can exchange advice about vitamin regimens, and advice about so many different issues. A lot of times patients come to us and ask which type of bariatric surgery is the best. And it varies with the individual circumstances. And so that's why we give patients an overview of all of the surgeries we perform here at Tri-City Regional Medical Center and ask them to consult with their physician about which surgery is best for them. Women who fall into the category of being obese often find that their sexual pleasure and sexual function is at a lower level than what they really wish it was. This may be due to a lower sexual desire, and it may be due to fatigue or anxiety. It can just be difficult for obese couples to have a satisfactory sexual relationship. Occasionally, the spouse or partner of an obese person may have difficulty finding that person attractive sexually, especially if they were not obese when the relationship started. Having a weight loss following bariatric surgery can increase the person's vitality and greatly increase their sexual performance and their desire for sex. Hormonal changes can take place, and this can be a much more gratifying experience for them following surgery. Following bariatric surgery, some women who were formerly infertile find that they can conceive a child. Often there is internal fat around the ovaries and the woman is not able to ovulate, and that in itself can cause infertility. But some women do have regular menstrual cycles, being obese, and even those women are found to have an increased percentage of fertility following bariatric surgery. In other words, they are more likely to be able to conceive following bariatric surgery and weight loss. It's important for women who are undergoing bariatric surgery to remember that they should not try to conceive during the first 12 to 18 months following surgery, because that's a time of really rapid weight loss, and it's possible that the developing fetus will be malnourished if conceived during that time frame. And so we always tell our patients, if they're sexually active, to use a good birth control device, because we do not want them to have anything but a wonderfully healthy baby. Obese women are more likely to have children with birth defects, especially neurotube type birth defects, spina bifida, cleft lip, cleft palate, than women who are of normal weight. Following bariatric surgery and weight loss, the incidence of these birth defects is reduced.